Hello, and welcome to this episode of our health podcast. Today, I want to talk with you about a topic that affects everyone, but can sometimes sound complicated: probiotics. Maybe you have seen probiotics advertised on TV or in shops. Maybe your doctor, a friend, or your family has told you to try probiotics for your stomach or your health. But what are probiotics? What do they actually do? When should you use them? And how can you choose the right probiotic for you or your family? Don't worry if you're not an expert. Today's episode will help you understand everything you need to know about probiotics in a way that's easy to follow but still correct and scientific. So, let's start from the very beginning. What are probiotics? The word probiotic comes from Greek. It means for life. But what does that mean in science and in health? Probiotics are living bacteria or yeasts that are good for you. When you take them in the right amounts, they can help your body, especially your gut and your digestion. But not every kind of bacteria is a probiotic. Let's say it again. Not every microbe you find in food, in the environment, or even in your own body is a probiotic. To be a true probiotic, a bacteria or yeast must be clearly named, so scientists know exactly what it is. Proven by scientific research to help people's health. Safe to use for healthy people. Organizations like the World Health Organization and the Food and Agriculture Organization first agreed on this definition in 2001. Since then, more scientists and health experts have confirmed it. Here is a simple way to remember. All probiotics are living bacteria or yeast, but not all living bacteria or yeast are probiotics. Let's talk about fermented foods. Maybe you eat foods like yogurt, kimchi, sauerkraut, or kombucha. These foods are made by fermentation, and they can have lots of live microbes. But not all these microbes have been tested to show clear health benefits. So many fermented foods are healthy, but their bacteria are not always official probiotics. Only certain strains that have been tested and proven are called probiotics. To be sure, always look for the name of the probiotic strain on the label. For example, you might see Lactobacillus rhamnosus GG or Bifidobacterium lactis, BB12. These names mean the bacteria have been studied and are recognized as probiotics. Why do we need probiotics? What are the real benefits? Now, let's talk about why people care about probiotics. Why do doctors, scientists, and many people around the world talk about them? The answer starts with your gut. Your gut, or your digestive tract, is home to billions of bacteria. Some of these bacteria help your body digest food, make vitamins, and even keep your immune system strong. But sometimes, the balance in your gut can change. Stress, illness, antibiotics, bad eating habits, or travel can cause your good bacteria to decrease and bad bacteria to increase. This is where probiotics can help. What can probiotics do for your health? Let's make it simple. Probiotics help balance the bacteria in your gut. They add more good bacteria, which helps keep bad bacteria in check. When your gut is balanced, you feel better and your digestion works well. Probiotics can help with diarrhea. Many studies show that taking certain probiotics can reduce diarrhea, especially if it is caused by antibiotics or an infection. Probiotics may help with constipation. Some people who have trouble with constipation feel better after taking probiotics. Probiotics can boost your immune system. Certain strains help your body fight off infections. Probiotics may help with allergies and lactose digestion. If you have trouble digesting milk, some probiotics can help you enjoy dairy without feeling sick. For some children, probiotics can help lower the risk of allergies or eczema. All of these benefits have been studied by scientists and written in reports by big health organizations. When is the right time to use probiotics? You might wonder, do I need to take probiotics every day or only when I'm sick? Here are some common times when probiotics are helpful. After using antibiotics. Antibiotics can kill both good and bad bacteria in your body. After a course of antibiotics, your gut may lose some good bacteria. Taking probiotics at this time helps restore the balance and can prevent antibiotic-associated diarrhea. When you have stomach troubles, if you have diarrhea, constipation, or irritable bowel syndrome, probiotics may help your gut recover. For babies and young children, sometimes doctors suggest probiotics for babies with colic, diarrhea, or special gut conditions. But always ask a doctor before giving probiotics to babies. If you cannot digest milk, lactose intolerance, certain probiotics help break down lactose, making it easier for you to drink milk or eat dairy products. When you want to support your immune system, if you often get sick, are recovering from illness, or during cold and flu season, probiotics can help strengthen your body's natural defenses. Some important notes about using probiotics. Probiotics are not a cure for every problem. They support your health, but do not replace medicines or a healthy diet. You should always choose the right probiotic and use it for the right reason. If you have a medical condition or are in a high-risk group, ask your doctor before using probiotics. Who should consider probiotics? Healthy adults. If you are healthy but want to improve digestion, or if you are changing your diet or lifestyle, probiotics can help. Children and older adults. Young children and seniors may have weaker digestive systems. Probiotics can help keep their gut healthy and support their immune system. People with stomach problems. If you have diarrhea, constipation, irritable bowel syndrome, or trouble digesting lactose, certain probiotics may be useful. People who need extra immunity. If you are recovering from illness or have a weak immune system, talk to your doctor about probiotics. Who should be careful with probiotics? Some people should not use probiotics without medical advice. People with weak immune systems, such as those with cancer, HIV, or who have had an organ transplant. Babies born very early or with very low weight. People who are seriously ill in the hospital. For these people, probiotics can sometimes cause problems, so always ask a doctor first. Are all probiotics the same? No, not all probiotics are the same. There are many types, and each type may have a different effect on your body. Probiotics are grouped by genus, the large group like Lactobacillus or Bifidobacterium; species, a smaller group like Acidophilus or Rhamnosus; strain, the most specific, like Lactobacillus rhamnosus GG. Even two probiotics from the same species but different strains can act differently in your body. Think of it like fruit. Oranges and apples are both fruit, but they taste different and have different nutrients. Even among oranges, there are many kinds, each with their own flavor and benefits. The same is true for probiotics. One may help with diarrhea, another with immunity, and another with allergies. How are probiotic products different? Probiotic products vary by number of strains. Some have just one type of bacteria, others have many. Dose. Measured as CFU or colony-forming units, this tells you how many live bacteria are in each dose. Some probiotics work well with small amounts, others need higher doses. Scientific proof. Some products are proven in studies and approved by health authorities. Others have less evidence. Remember, more strains or higher numbers are not always better. What matters is that the product contains the right type and amount for your needs and that it has been tested. How to choose the right probiotic. It can be confusing to choose with so many products. Here are some simple rules. Read the label carefully. Look for the exact name of the probiotic strain. Choose products registered as medicine or health supplements. Buy from trusted sources. Go to pharmacies or buy from well-known companies. Trust brands that give clear contact information and instructions. Store it correctly. Some probiotics need to be kept in the fridge. Others can stay at room temperature. Read the instructions on the box. Try and see if it works. Every person's gut is different. Try a product for about a month. If you do not feel better, you can try another one. Check for scientific proof. If you want to learn more, look up information on isappscience.org or in reports from WHO, FAO, or EFSA. You can also search Google Scholar or PubMed for studies using the probiotics strain name. Ask a doctor if you have health problems. If you are not sure, ask a doctor or a dietitian for advice. When is the best time to take probiotics? Usually, you should take probiotics when your stomach is empty. That is about 30 minutes before eating, or at least 2 hours after eating. This helps more bacteria survive the acid in your stomach and reach your intestines. Some probiotics can be taken with food, especially if the label or your doctor says it's okay. Always follow the instructions on your product. Should you take probiotics every day? Yes. Probiotics do not stay in your body forever. To get the most benefit, take them every day for as long as you need. Most people use probiotics for at least 1 week, 2 weeks, or 1 month. If you stop taking them, the bacteria will slowly leave your gut, and the effect may go away. How long does it take to feel a difference? Most people need to take probiotics for at least 1 to 4 weeks to feel an improvement. Some may notice changes sooner. Others may need more time. If you do not see any result after a month, it might be time to try a different probiotic. Can you take probiotics with antibiotics? Yes, you can. Some probiotics are strong enough to survive even when you are taking antibiotics. But to help the probiotics work better, take them 2 to 3 hours after your antibiotic. This gives the bacteria a better chance to live and help your gut. Final reminders. Always read the instructions for your probiotic product. Follow the advice of your doctor or healthcare professional. Probiotics can support your health, but they are not a cure for everything. Let's review what we've learned today. Probiotics are live bacteria or yeast that can help your gut and your health. Not every bacteria is a probiotic. Only certain strains that have been studied and proven are real probiotics. Probiotics can help balance your gut, support digestion, boost your immune system, and help with some allergies and food digestion. Use probiotics after antibiotics when you have stomach problems, or if your doctor suggests it. Always choose a product with the right strain, dose, and scientific proof. Store and use probiotics as directed. Take them on an empty stomach, and take them every day while you need them. If you have health conditions, always ask a doctor first. Thank you for joining me for this episode about probiotics. I hope you now feel confident and clear about what probiotics are, when to use them, and how to choose the right one.